Hi, my name is Jason Ketchum. I'm from PatientIQ. Thank you for coming today as we're going to do a demo of our new DataPRO product, which we're incredibly excited to display at AAOS this week. So who is PatientIQ? PatientIQ has been around for about 10 years. We have historically been known as an orthopedic platform deploying patient-reported outcomes programs in private practices and health systems across the US. We are rapidly becoming even better known as a standard of care tool. And so what does that mean? Ultimately, the PatientIQ platform unlocks a few things. Our Clinical Pro, our Research Pro, and then starting this week, DataPRO, which is performance benchmarks and AI-powered insights. So ultimately, we want to make sure that we're connecting the entire ecosystem, making sure that through the lens of the patient, you have optics into how your performance is, both from a surgeon level, at a service line department level, and then beyond. We got to this point because our efforts and our collaboration with all of our partners across the US over the last 10 years has created a robust data set that we can start to parlay into giving those insights and how people are performing. So we'd like to thank every single person that you see on this board. They were critical in order to get us to the point where we can launch this. Today, we're working with over 700 organizations, 5,000 sites of care. We've enrolled over 10 million patients, and we're doing over 1 million PROs every single month. And so what is DataPRO? DataPRO leverages PatientIQ's extensive data set of real-world PROs collected via Clinical Pro to empower healthcare stakeholders with market intelligence to drive and power informed decision-making. So we used to say that we unlock data-driven insights and the practice of data-driven medicine, and we're continuing in that trend today and pushing that even further. So we're supporting real-time procedure-level benchmarking against the largest network of PROMs in the US. We're identifying best practices and elevating those up so you can figure out what's working and then bring that to scale and help you recognize high-value patterns. The performance benchmarking started for CMS, TKA, and THA, PRO, PM. So what is it? I think most people here know, but there might be a couple people who are still a little bit curious about the specific definition. So the patient-reported outcome-based performance measure, or PRO, PM, was developed by CMS to assess functional improvement after elective total hip arthroplasty and total knee arthroplasty. So how does it work? It measures the change in patient-reported functional status from pre-op to 1 year post-op using the PROMIS 10 Global, Who's Junior, or Who's Junior surveys. It's adjusted for patient risk factors to ensure fair comparisons across providers, and it's aimed at driving quality improvement, value-based care, and orthopedic surgery. So you're going to start to see some of the visuals here, and we'll go through a little bit more of a formal demo, and I'll kind of do some click-throughs so you can actually see what it looks like and what it unlocks for you. I just want to start to kind of tease and plant that seed for what you're going to be seeing in just a minute. The first iteration of DataPRO is built around the standards set by CMS. And using all of the collaboration and the information we're gathering every single day, because this has been in the field for a little bit with our alpha testing group, we're going to continue to build upon what we've done, but what you're going to see today is based on just that specific requirement. And the requirement at 1 year post-op is a 22-point improvement for Who's and a 20-point improvement on the Who's. What's coming soon is going to be benchmarking for additional interventions, more sophisticated compare factors, and far more robust AI insights. So think about us giving you the ability to have contextually relevant conversations with your patient while they're right next to you in clinic. Patients are literally seeing you hear their voice. And that's incredibly important not only for patient satisfaction, but ultimately to understand if I say something to my provider, it's being used to inform my care. That's going to make them far more likely to want to share that information, setting themselves up for a better outcome. All right, so let me just click out of here real quick, and I'll actually show you the platform. All right, so market intelligence built on real-world data. Here we go on the tour. It's our latest innovation. We're super proud of it. Its access is an add-on in Clinical Pro. So if you're in our platform, you go straight up to the benchmarking tool. Once you subscribe to DataPRO, just talk to your customer success representative. We can get you turned on right away. The tab's going to appear for you. Step 1, focus on your organization-specific metrics. So the first panel, you're going to see visuals of the distribution for your PROMs that are collected at your organization. The success metric benchmarks shown are going to be set to the CMS, THA, TKA, PRO, PM program. And we do need 1 year of data to make sure that we can have a robust enough data set to make this relevant for you. And again, at the 1 year post-op, 22-point improvement for the Who's and 20 around the Q's. That's important for context setting. Then we want to start to go through and review the key metrics. So this chart that you see here is the total number of procedures for the selected intervention type, the total number of unique providers performing these procedures within the organization, and the total percent of procedures that had improvement above the desired benchmark. So remember when I said there's critical benchmarks that I want to make sure we're setting you up to think about. So what does it ultimately mean? Out of 100 patients that received TKA in your facility, 68% of them saw a significant post-op improvement. Said otherwise, 32 patients did not see a significant post-op improvement. So this is going to be a tool that's going to elevate those insights for you, and we'll start to show you the different layers in which it's doing it. So the organization standard is top 10%. So in this particular illustration, you're starting to see that your organization is the top 10% of PatientIQ clients performing against that particular procedure. And once you actually understand where that goes, you can start to look at the overall network ratings across the robust data set of the PatientIQ ecosystem. So you compare your performance against the broader network, which is what you see here. So you can see the total number of unique providers. It is de-identified information, so we're really trying to push the whole industry forward here. We're not trying to shine a spotlight on one individual. We're really trying to broaden the category. So how are they calculated? Our metrics represent the total number of procedures that are counted, which is determined by the number of procedures with both baseline and post-op scores. So we want to make sure, again, there's contextual relevancy to the data set and fidelity in the data. Highlighted over here on the right-hand panel is 100 out of the 100 patients that received a TKA across, 63% of them saw a significant post-op improvement. So that's great news. So if this is your organization, it means your organization's outperforming the network average. So again, it's not trying to draw people out. It's just trying to make sure you understand what's working and what's not working against a broader population to help drive continuous improvement. All right, we do have a number of other interventions that are going to be coming. So you can start to see different things. So from joint arthroplasty, spinal, ligament, and soft tissue. So these are things that are going to be coming on the near horizon. For joint, partial, total, and revision of the hip and the knee, total ankle, total shoulder. On the spine side, cervical spinal fusion, lumbar fusion, and then ligament and soft tissue as well. And there's going to be more coming behind. So I just wanted to kind of show what's in the near term. We like to think about things in a now, near, and a future sort of framework. So what you're seeing today is the now, and what I'm showing you here is the near. And future state is going to be a robust data set where we're going to be able to elevate this up across all of your intervention types. All right, you can actually start to get, like I mentioned, at the individual provider level, you can see how they're doing. So this particular panel is going to look at every single provider in the practice. It's going to illustrate how they're doing from a pre and a post-op standpoint, and then show that ranking. You can see the percentile column right next to that, and that's obviously just going to show folks who are outperforming their peers. So you see, Dr. Mahon in this particular example is the top 5%, and you can see folks who may be in the bottom 50%. So you start to say, hey, what's separating Dr. Mahon, who's driving up and is really sitting at the top of the peer group, compared? Is it information that's contextually relevant and sort of setting the context with that patient? Whether that's a BMI conversation or earlier intervention, somebody who's presenting with depression. There's a number of factors that go into that, but that's something that you start to dig into, and we can help elevate and raise those insights for you to help just make sure you're practicing better medicine. Or being armed with the data is probably the better way to say it, to practice better medicine. And then there's the score column. So the score column is going to indicate the percentage of procedures who have reported above the threshold improvements. And I want to say it again, I think it's the 5th time, 22 points for the WHO's, 20 points for the Q's Junior. And you start to see how that distributes out. Folks who know the PatientIQ platform know that we love data and we love analytics, and we love trying to do our best to raise that up for you in ways that can be impactful. So we have the count column as well. Indicates total number of procedures in a given time frame. And you can see the median baseline and the median 1 year post-op as well. And then one of my favorites, not just because I love saying it, but I love the visual. On the right, you're going to see the whisker and box plot, or the box and whisker plot, that offers a visual representation of the table data that you've just reviewed. So we're going to kind of show you how to break this down in just a second. But ultimately, we want to make sure that we're showing you all the specific patient factors. So the panel is used to compare distinct patient factors for procedures within your org to procedures at organizations within the broader PatientIQ ecosystem. And the purpose is really to help you identify opportunities for improvements. Again, we're just trying to help everybody elevate and leverage data in order to do that. We also have our baseline scores here. So this is just shown as an example. The baseline scores display your pre-op, who's junior and who's junior. The count column indicates the number of patients. Then you can start to see where your organization fits across the broader category. All right, so how do we interpret the data? Your baseline score in this particular example is 12 through 21. The count value is 10, and your organization value is 80%. So this means 8 of your patients within a reported baseline score between 12 and 21.99 achieved the desired score improvement on their 1-year post-op. And the goal of the baseline score comparison factor is to determine the likelihood of a patient achieving the clinical benefit benchmark based on their pre-op baseline score. So the higher the baseline score, the less likely it's going to be for a patient to achieve the 20-point improvement for the who's junior or the 22-point improvement for the who's junior at the 1-year post-op. Like I mentioned before, there are a number of factors that come into play, whether that's a patient presenting with depression or potential BMI or other indicating or mitigating factors to maybe social determinants of health. And so you want to make sure that those factors are raised up so you can make sure you have the appropriate non-surgical intervention to get that patient prepared for surgery. Some folks who've been around here, I'm not sure if they're in this group, also we're talking about nutrition, making sure there's nutrition factors to kind of help drive some of that positive outcome as well. So these are all things we want to make sure that we're elevating for you. And the PatientIQ network indicates the percent of patients with that baseline score that achieve the clinical benefit benchmark across our entire network. So again, we're trying to make sure what's happening at the provider level, within your organization, and then across the broader ecosystem. And then for folks who are unaware, about 1/3 of all orthopedic surgeons in the US are currently on our platform. So it's already a robust ecosystem. And then last but not least, the histogram shows how many of your patients achieve the clinical benefit benchmark as compared to the network, grouped by baseline score average. So we're trying to serve this up in whatever manner is going to be best for you to consume, depending on the visual and the type of access to that information you're trying to get. So why do we have an empty section? This graph displays patients with a minimum of 20-point improvement on their baseline scores. Patients with a baseline of 80 plus are not able to achieve a 20-point improvement increase, so they don't qualify to go on the graph. So if you have any questions, we have a number of folks here. All the PatientIQ folks, raise your hand. You can also just look at the name tag. I know it's kind of small for people. But please let us know if you have any questions, whether that's something that you want to turn on fairly quickly, whether that's something you want to have a further conversation with, or any feedback that you have. We're excited to launch this today and this week, and so we're here all week to answer those questions for you. Thank you so much for coming. Take care, everybody.